Now, the National Vaccine Monitoring Group will embark on mass action tomorrow, demanding what it calls equal access to vaccinations for all South Africans. The lobby group says the current distribution of vaccines is unequal and poorer communities remain marginalized. For more on this, we're joined by the organization's national convener. Bongani, good evening. Good to have you with us tonight here on In Focus. Talk to me about who the National... Yes, who's the National Vaccine Monitoring Group?
The National Vaccine Monitoring Group is a group of community leaders in around the country who have been doing much work since this pandemic started. They started mostly in the Gauteng, where they were educating people about the coronavirus, leading to people to stay at home or to sanitize or to keep social distance. But therefore, at some point, we started working with people at UJ, the Center for Social Change, where we conducted a research on what's on the ground, and monitoring the vaccine, looking at how our people are responding to the vaccine and what are the challenges and how can we come with solutions. And one of the things that we realized was that like most of our community leaders, your ward councillors, your teachers, or either pastors in churches and all that, were not involved in the vaccine rollout. And as a result, we saw many people being hesitant or not responding very well to the vaccination.
Yeah.
We therefore started a team whereby we wanted to educate people, a team that wanted to go on the ground and educate people on the importance of getting vaccines. So that's how the National Vaccine Monitoring Group was formed.
So the non-involvement of people in communities that people can trust, you're citing that, or at least based on your research, as among the reasons for low uptake of the vaccines?
Yeah. So our research showed us community leaders look up to either their ward councillors or community leaders or traditional healers and all that. And the lack of involvement by the government to those leaders makes many people to be hesitant. There are people who listen to the government. There are people who listen to their community leaders. That's why we have ward councillors. That's why we have community leaders. And as they say, if they encourage people to say, let's get vaccinated, many people will act positively. But what we saw is a top-down approach rather than a bottom-up approach, where you involve members of the communities to assist in this crisis, to be the one on the forefront that says we need to get our people vaccinated.
Yeah. So tell me then about this observation that you're saying here, that you're finding there is different treatment when it comes to the administration of vaccines, depending on your nationality or depending on your immigration status. What is the example of that, and how does it manifest on the ground?
Yeah. So the allocation of vaccine sites, for instance, a person that has a medical aid or a middle class or rich person can be able to go either on a private hospital, Discam, clinics, and a public hospital. Those are the benefits, and get vaccinated. With a person that stays in the informal settlement, in Tembeli, Lineza, or Protea South, or any informal settlement, or even in villages, they have a challenge that, like, in order for them to get vaccinated, they have to pay a certain amount of transport, because vaccination sites are not within where poor communities are. And that becomes a problem. So for somebody who's poor, who have 30 rands or 20 rand to buy milk and bread, he or she has to compromise that money to get to the vaccination site, which that makes things slower, or make people not to decide to use their own money for food than going to the vaccination site.
Yeah.
So that's where we say the government makes a problem, whereby if they bring vaccination sites into communities and people are accessible to vaccination sites, even on weekends in communities, then it will make a huge difference, and we will see people getting vaccinated.
Yeah, and you're saying this decision to sparsely, I suppose, allocate vaccination sites in township is a deliberate discrimination?
So like what the government did was to centralize vaccination sites in either big hospitals or in either areas where mostly people can be. But the problem is this, like in poor communities, that's where we argue this, is that like in poor communities, there are no vaccination sites. In poor communities, there are clinics that can be utilized. We have also mentioned to say the vaccination site does not need much things. It needs a cooler box and a tent and a chairs for people to be able to be vaccinated. And that could happen. It can easily happen. That's why now they are having this pop-out site. But pop-out sites are not something that are reliable, because they come today and tomorrow they leave, or they come today for 3 days and then they leave. Most of people, sometimes they are at places where they're trying to find food. By the time when the pop-out site is in their communities that came for that 2 days or 1 day. So if government can utilize the clinics that are within the communities, like for instance, in Protea South, there is a clinic that is there in that informal settlement, but it's not being utilized or used to get people, the population of Protea South, which is about 20,000, to be able to be vaccinated in that clinic. So those are the problems that, like you were seeing, to say, through our research, when we go around the country, most of people are complaining about transport. It's to say, how do we get there? Seemingly, the government does not recognize the poor. When it comes to issues of local elections or votes, they even come and take our votes within our own houses, where, like you think of that, they are poor old people in that house, age of 100 or age of 98, that we must go to their houses and get their votes. Why can't they do the very same thing in poor communities, whereby they go into their houses and vaccinate them in those informal settlements and all that? That's what we are raising, to say this is discrimination. People, poor communities do want to be vaccinated, but they are not accessible to vaccination. They are not accessible to sites where they can be vaccinated.
Bongani, thanks for coming through and raising those concerns very sharply with us here tonight. Convener of the National Vaccine Monitoring Group. They will be taking those grievances to government tomorrow.